Bismillahirrahmanirrahim. Today I'm going to talk in English, but I will mix it because I can see some people they are Urdu speaking and some people they are English speaking. And whenever we want to talk in our mother language, we are more clear what we want to say. It's not like that nobody can speak English and nobody can understand English. There's no problem because we are living in this country and everybody knows. And accent, everybody has accent. Doesn't matter like if you have accent of the south side, north side, everybody has accent. So please feel free the way you want to ask me the question, and I want it, you should like contribute in this discussion. Every day we are talking about the problems and the causes. I am okay with that. I will talk a little bit about problems and the causes, but mostly today I want to focus on the solutions. For the solutions, I need the interaction, and I need the interaction in the mother language. If I understand that. If some people they speak Arabic, I can't understand Arabic, I'm sorry for them, but definitely I want it. Talk to me the best language I can understand. Punjabi, I can understand Hindi, I can understand Urdu, I can speak definitely, I have to speak in English because I'm living in this country. That's why this is very important. And I will repeat as our sisters, they will come, I will repeat this thing again because I feel that language barrier is creating a lot of problems, a lot of problems. We are doing so many programs, but we are not getting that. That's why I changed it. I told everyone, because one time I was giving a lecture in some place and they are like Urdu speaking people, mostly. And I have to deliver in English and they were trying to ask me the question in English. It's difficult because if I am speaking in English, I have to think in my mother language, Punjabi, then I have to translate it to Urdu, then I have to say in English. Long time I'm talking about this thing, it's easy for me. But if I have to think about my emotions, it will be very difficult. And today's talk is all emotions, all the problems and issues and mental health stigma. I'd like to introduce myself a little bit, but thank you, whatever you introduced me. Why I want to introduce myself, I will tell you. It will help you to understand the mental health stigma. I did my first master's in genetics. I was geneticist for 10 to 15 years, almost. I don't like that, I hate that, but I have to sit and do that. At that time, computer sciences was very charming, blah, 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 those things. I thought maybe computer sciences is my passion. I wanted to do the computers. I did the second master's in computer sciences, which is again another flop movie. And then I worked for like a few years, not a few years, like few months you can say. And I ended up to see my therapist. That's the journey what I want to talk to you guys. I ended up to see my therapist. I was very judgmental about therapy and therapy process. I was judgmental by myself about therapy and therapy process 20 years back, not now. And I ended up to see my therapist and I didn't want to go because of my culture and my upbringing. The culture I belong, mostly I think we all belong to the same culture. It's not only the Pakistani, American, or some specific culture, it's all cultures. You cannot imagine the white, black, brown, all the people, they have those issues because this is an issue from here. It's not a cultural thing. That's a huge, big mistake which I want to be very clear about that. This is a problem in all the generations, in all the cultures, in all the language. This is a problem. And I was the same. I was thinking like, oh my God, if I will go to the psychologist, people will think I have a problem. Still today, people are coming, CEOs, company owners, big, huge scholars, they are coming to me. You know what they are saying? You know already आपको पता है कि कोई mental issue होगा, घर में कोई problem होगी. I said, okay, you know that I am facing something, that's why I'm with you, there is something going on in my mind. These type of questions came to me and it means mental health stigma is still there. But Alhamdulillah, I'm very blessed. My therapist changed my life 360. Then I realized what I want to do it. I said, oh my God, that's my calling, which I was waiting so long. And then this is my habit. If I start something, I want to start understand everything. And secondly, I want to finish whatever I start, as I told you before that. But this become like my passion. I did third master's in psychology. I did postmasters in psychology. I did PhD in psychology. I'm CBT, EMDR, neurofeedback, biofeedback. Alhamdulillah, Alhamdulillah, you can Google my name and you can see all my specialties. Why? I do so many specialties because I like to compete with myself. I'm not a person who will compete with her, with you. I all the time compete with myself. All the time I wanted my 2025 should be better than Dr. Saima's 2024. My challenge is me, not anybody else. It creates so much positivity in my life around me. The people who know me, they will all the time say one thing, the positivity and no competition. I never ever compete with anyone. People, they are coming to me, they are becoming the psychologist, I help them, I help everyone because everything, whatever I'm doing is for Allah subhanahu wa ta'ala. And I am making my intention right now for this lecture again. I make an intention in the morning that please Allah accept it from me. I travel, I came here for you guys, and I'm praying to Allah subhanahu wa ta'ala. My all intentions is for Him. Whatever the right I will say, it's because of Allah subhanahu wa ta'ala. If I will say something wrong, it's because of me, not anybody else. That's why I'm talking about those things. I'm going to talk about mental health stigma, and secondly, I'm going to talk about what people say. लोग क्या कहेंगे? अगर मैंने ये किया तो लोग क्या कहेंगे? What the people will say. We have a big, huge issue with what the people will say. And I started with that. No competition. Compete with yourself. Your kids, they take like an A grade, they should have an A plus next year, not with somebody else. Because huge problem, mental dissonance, mental cognitions, mental distortions, all these things, if you can Google, you can see how it's affecting your mind very badly. It affects your mind very badly, competing with the other people. Competing with the other people, it is affecting your mind. I will show a little like experiment where you can see how your mind is affecting when you are gossiping about other people and when you are talking about the people when you are competing. That's the major issue in your life. If you will ask me, Dr. Saima, you have like a 2 minutes and you just have to say the best thing, whatever you understand all those years. I say do not compete with anybody else and don't think what the people are doing or what the people will say. Focus on yourself. Because, alhamdulillah, all the sisters sitting there, you are very close to Allah subhanahu wa ta'ala. I can see that salah is not your problem. Fasting is not your problem. Zakah is not your problem. Hajj is not your problem. Nothing is your problem. Your problem is what? What is your problem? Talking about the other people. Because we need a Islam. We are doing the Islam, we need your betterment. We forgot the thin line between what we are talking, what we are doing, what we are absorbing in our mind very badly. Firstly, I will tell you the all bad news, but my promise at the end of this session, you guys will have a lot of good news in mental health. That's the major thing. And secondly, let me explain to you how your mind is affecting when you are competing with other people and when you gossip about the other people. जब आप चुगलियाँ लगाते हो और what are ये मेरी आप if you will go on my YouTube channel, my Instagram, you will see the best top things all the time, all my thing. I feel like Allah subhanahu wa ta'ala, He sent me in this world to work on the 2 things. कि औरतों को बचाऊं कि चुगलियाँ ना करें. I just wanted the people, they should not talk about other people. And secondly, do not compete, cooperate with other person. Cooperation. We are the follower of Islam. We are Muslims. And what Sahaba taught us, what Muhammad Sallallahu Alaihi Wasallam, whom we are following, this is not our life. Pray. These are these 5 things. We cannot say we are the Muslims if we are not doing those 5 things. Islam starts right after that. And when I was combining psychology and Islam, I can see, oh my God, everything, whatever Quran is saying, everything, whatever modern psychology, modern neuropsychology is saying, it's under the Quran. People used to say, I used to attend the IFNA conventions and my colleagues at that time, they were saying, oh, if you will read Quran, if you are close to Allah subhanahu wa ta'ala, you will not have a depression. That was a lot of talk. And I used to talk with them I said, no, this is a disease. And they start talking about that, yes, this is a disease, but What's the point behind that? All my 20 years in this field. Who knows, who understand Islam and Quran, they will not have a depression. My conclusion is that they will not have a depression. Why? Because the way you read the Quran, the way you approach the hadith, the way you read